We're talking about healthcare. We're talking about seniors. We're talking about home care. And this is Bridget Brown with Gentiva. And Bridget, tell me a little bit about this. How does that work? Because a lot of us are familiar with assisted living,
right,
where even where people go to rehab. What about in-home care?
In-home care allows the patient to basically recover at home so that they can age at home and stay at home. So what we do is we provide services like nursing, physical therapy, occupational speech therapy, and home health aides. So when someone's recovering from injury or illness, surgery, we're there. We take care of them right where they live.
Let's talk about the psychological aspect of that. Sometimes people can recover quicker and better, faster, when they're in an environment that they're more comfortable, right?
There's no place like home. There's no place like home. And we come to them, and they're able to sleep in their own beds. And if they do need adaptive care, it's like a hospital bed or a walker or a wheelchair, we can help them with all of those needs and use those adaptive equipment easily and as necessary.
And you also monitor how their progress is, right?
Absolutely. So we're taking care of their vital signs, and we're making sure that they're taking their medications properly. We're making sure that they're not falling down and getting injured and having to make extra trips to the hospital. We're basically the eyes and ears of the doctor in the home.
And you see this business, this part of the home health care growing, right?
Absolutely, because it's been proven that home care is the best way to provide medical care. It's the most cost-effective way to provide medical care.
I'm talking with Chris DeVito, who is with Vitas, and Vitas is a hospice, and a lot of us are familiar with hospice and the great work that you guys do. I mean, I cannot say enough kind things about all the kindness that you show people who are in the last stages of life. So tell me a little bit about your organization and what made you want to get involved with this?
Well, I have to agree with you in the way that I think it's the work that we do, and Vitas treats people at the end of life, and for us it really is a mission about providing quality, having people enjoy every moment of their life, and we do this, through an interdisciplinary team, a doctor, a nurse, a chaplain, a social worker, all really focused on a patient and a family and helping them live the life they want to live.
And there's another word that just pops into my mind immediately: respect.
Absolutely, respect. I think in medicine we're used to the medical community taking the lead, but with hospice it's really the patient and the family that take the lead, and we look to them to kind of drive their care, and that experience is different for each person.
And tell me about your company, in particular, Vitas.
Okay. Vitas is one of the largest and oldest national hospices. We're based out of Miami, but we've been here in Brevard County for 11 years. Our mission really is that, patients and families come first, and it's what drives us and motivates us every day.
What do you know about Buena Vida? You will know a lot more because we got Chris Byrne here to tell us all about it. Now, I understand that you guys are not only successful, but you're doing some great work out there.
Yes, absolutely. We're a CCRC, which is a continuing care retirement community, and what we have is the independent living, assisted living, memory care, all the way through the life cycle into skilled nursing, and also hospice care until the end of life.
All right, now tell me, I'm approaching that age. I don't want to necessarily keep mowing the lawn. What do you got for me?
Well, we have an awesome place. It's you come in under the independent living. You have beautiful, spacious apartments there. Actually, if I could, I'd live there myself. There's two bedrooms, extra room, 2 bathrooms. It's beautiful. We have a wellness program. We have a fitness room. We have Tai Chi. We have yoga. We have dance lessons. We have card games constantly. We have board games. We have all kinds of activities. Are we
going out to restaurants?
Absolutely. We go to the theater. They go and see the musicals. there's anything that you could possibly think about doing when you lived at home on your own, you can do there, only we bring it to you or bring you there.
What about meals and things like that?
Meals are all included. You get your dinner. Actually, in the mornings, it's more of a continental breakfast. And then what they do is have a lunch and they have dinner. We also have a bistro. We have, what am I trying to say? Pool. They play pool in there. Okay. We have poker tournaments, all kinds of things. And we are huge on parties.
And
we're known for parties.
And the name says it all, and it's Buena Vida.
The good life.
The good life.
Yes, absolutely.
Hi, are you going to be on the TV? Well, of course you're going to be. You're the most important person here because you're the one that's signing everybody up. You're making all this possible.
Awesome.
And you are?
I'm Michelle Lewis.
Hi, Michelle Lewis. I love you. You're doing a great job.
I love you too.
I'm Megan Vegas. How are you?
You're one of the unsung heroes of this event.
Well, my colleague Joanne Fisher has been getting this organized for quite some time, and she and I and our practice group with Dr. Potomsky have been pulling this off for many years, so I'm glad to be a part of it.
But you're in the trenches.
I am.
You're getting everybody signed up.
I am.
So thank you.
Thank you. It's nice
That's
to
what we're
meet
doing.
you.
We're just saying thank you. Tell me your name.
I'm Jane, and I used to Jane Simpson.
Jane Simpson. Okay.
I worked with Dr. Potomsky before. Now I'm in Texas.
Oh, and you came back for this event?
Yes, I did.
Well, you guys are the unsung heroes. You're here on the front lines and greeting everybody and making the first good impression.
Yeah, thank you.
So we want to say thank you.
Thank you.
And you are?
I'm Joan Burrick.
Hi, Joan. Nice to meet you. Wanted to say thank you for all you're doing tonight here and being on the front line, meeting and greeting everybody and setting up the best, good first impression.
Oh, well, thank you very much.
Well, thank you.
We try hard.
Yeah, we try hard.